Welcome. Call this regular scheduled meeting of the Nicholas County Commission to order. Today is Wednesday, October 4th, 2023, and it is 9:10 a.m. We do not have anyone for public comment, and so if one of you gentlemen would like to begin with the motions.
I'll make a motion that we review and read and waive the reading of the minutes from September 20th, 2023.
That motion is on the floor. Is there any discussion? Hearing none, all those in favor signify by saying aye.
Aye.
All those against, the motion does carry.
Upon review of the exonerations as presented by the Nicholas County Assessor, move to approve accordingly.
Motion's on the floor. Is there any discussion? Hearing none, all those in favor signify by saying aye.
Aye.
All those against, the motion does carry.
Upon review of the estate and judiciary matters as presented by the Nicholas County Clerk, move to approve accordingly unless otherwise noted.
That motion is on the floor. Is there any discussion? Hearing none, all those in favor signify by saying aye.
Aye.
All those against, the motion does carry.
Upon submission of budget revisions received from the elected officials and department heads, the commission will take appropriate action as deemed necessary.
That motion is on the floor. Is there any discussion? Hearing none, all those in favor signify by saying aye. Aye. All those against, the motion does carry.
Upon review of the invoices as submitted by various departmental heads, the commission will take appropriate action as deemed necessary.
That motion is on the floor. Is there any discussion? Hearing none, all those in favor signify by saying aye.
Aye.
All those against, the motion does carry. For the terms of office expiring this morning, we have a slew of them beginning with the Nicholas County Parks and Recreation Commission. We did have two resignations. Mr. Joey Myers, term of office expiring October 15, 2025, and Mr. Tim Lewis, term of office expiring October 15, 2024. If we could first have a motion to accept those resignations, and then we can do our appointments. That motion is on the floor. Is there any further discussion? Hearing none, all those in favor signify by saying aye. Aye. All those against, the motion does carry. We appreciate their time on the commission. They both did quite a bit for the park during their time on that board. Now, there are those two positions. The unexpired term of Joey Myers, the unexpired term of Tim Lewis, and then also Miss Kathleen Curry and Miss Tracy McCoy's terms are up as well. Mr. Roberts, we did receive two recommendations, right, for Mr. Myers and Mr. Lewis?
Yes. So Joey Myers was our representative from the soccer community, and they had recommended Amy Cook to represent them as well. She's heavily involved in the soccer community right now.
Okay.
I'll make a motion.
That motion is on the floor to appoint Amy Cook to the unexpired term of office of Joey Myers, term of office expiring October 15, 2025. Any further discussion? Hearing none, all those in favor signify by saying aye.
Aye.
All those against, the motion does carry. And then for the Lewis appointment.
Yeah, we had the talk to Stephen Postleway about it. He had expressed a desire.
I'll make a motion.
That motion is on the floor to appoint Stephen Postaway to the unexpired term of office for Tim Lewis, a term of office expiring October 15, 2024. Any further discussion? Hearing none, all those in favor signify by saying aye. Aye. All those against, the motion does carry.
I'll make a motion that we extend Kathleen Curry and Tracy McCoy.
Okay, that motion is on the floor, placing both Miss Kathleen Curry and Tracy McCoy in terms of office expiring now, October 15th of 2026. Any further discussion? Hearing none, all those in favor signify by saying aye.
Aye.
All those against, the motion does carry. Up next, we do have the Craigsville Public Service District. This is Miss Joanne Flynn, with a term of office expiring October 18th, 2023. And these PSD districts are 6-year terms. Patty, do we know if she's willing to serve another term?
As far as we know, she is.
Okay. So we have Miss Joanna Flynn or any other nominations for that position?
I'll make a motion we renew her for the next 6 years.
Okay, that motion is on the floor to appoint Joanna Flynn to the Craigsville PSD, a term of office expiring October 18 of 2029. Hard to believe we're already talking numbers like that. Any further discussion or nominations? Hearing none, all those in favor signify by saying aye. Aye. All those against, the motion does carry. The Nettie Levacy PSD, we have Mr. Glenn Sterling with a term of office expiring October 10, 2023, again for a 6-year term. To my understanding, Mr. Sterling is willing to continue his service, and I have also, I'm sorry.
No, I was just gonna say, we did have a gentleman.
Well, yes, I'm in this PSD, so I've been approached by 3 different individuals, and really, with the complications of this district, it might even be in the commission's interest to actually interview before we appoint. And I can try and set those up before the next commission meeting.
Yeah, we need a motion on that.
Should we move on that, or just do it, or to interview before we appoint?
No, you can do that anytime.
Just do it, okay. So let's have a motion to table until the next meeting. How about that?
I'll make a motion to table that and do some research.
Okay. All those in favor signify by saying aye.
Aye.
Aye. All those against, the motion does carry. The Nicholas County Building Commission, we have Mr. George Gerald, term of office expiring October 17, 2023, and these are for a 5-year term. To my understanding, George is still interested in serving. I have no other nominations at this time myself. Is there any nominations for the Nicholas County Building Commission for the seat?
I'll make a motion to keep George in office.
Okay. That motion is on the floor. Any further discussion or nominations? Motion is to appoint George Gerald to a term of office expiring October 17 of 2028 to the Nicholas County Building Commission. All those in favor signify by saying aye. Aye. All those against, the motion does carry. The Nicholas County Airport Authority, Mr. Jamie Thomas with a term of office expiring July 1 of 2023. This is a 5-year term. To my understanding, Mr. Thomas is still willing to serve, or if you have any other nominations for this seat.
Make a motion to continue.
Okay, that motion is on the floor to appoint Mr. Jamie Thomas to a term of office expiring July 1 of 2028 to the Nicholas County Airport Authority. All those in favor signify by saying aye.
Wait.
Did I say that right? Okay. Always stop me if I do say something wrong. But all those in favor signify by saying aye.
Aye.
Aye. All those against, the motion does carry. It mentions the train unit, but let's just talk about that later because we are behind time anyhow. That being said, it's like a blast from the past. We have the attorney himself, Clint Bischoff, and Cassandra Lawson, the Senior Project Specialist from Region 4 Planning and Development Council. And this is regarding Hinkle Mountain Broadband Internet. So welcome to you both. Glad to have you. What do you have?
Commissioners, good morning to you all. The matter that is on the agenda today involves a pending legal matter. I'd ask that the Commission consider going into executive session.
There's no issue in that. Okay. Do I hear a motion to enter into executive session pursuant to West Virginia Code 6-9A-4? This would be with retaining Mr. Clint Bischoff and Ms. Cassandra Lawson in the room with the commission, as well as Mr. Greg Tucker as well. So moved. Motion's on the floor. It is 9:19 a.m. Any further discussion? Hearing none, all those in favor signify by saying aye.
Aye.
Aye. All those against, the motion does carry, and we do stand in executive session. Okay, we're going to exit executive session. This is pursuant to West Virginia Code 6-9A-4. It is 9:50 a.m. And for the record, no decisions were made during that executive session. Do we have a motion? Motion's on the floor. Any further discussion? Hearing none, all those in favor signify by saying aye.
Aye.
Aye. All those against, the motion does carry. We do stand out of executive session. We again have with us Cassandra Lawson, the Senior Project Specialist for Region 4 Planning and Development Council. This is now regarding the Birch River Generator Project, scope change, and Birch River PSD Mill Creek Waterline Extension Project with a CDBG budget amendment.
Yep.
That's a mouthful.
Yeah, it is. It's really fun. If you don't mind, I'll start with the generator and then we'll move on to Mill Creek. So the generator project went to bid, the contract was awarded to the lowest bidder, and then when the contractor went to place the order for the three generators, there was a 100 kilowatt, 270 kilowatt generators and 125 kilowatt generator. And they're gonna do purchase from Cummins. Cummins came back and indicated that 25 kilowatt generators are not currently available because I guess the motors are outsourced from China and that manufacturer has just completely stopped production. So it's not only them, it is also all of their competitors. And so what we would like to do is ask FEMA to allow the PSD to purchase a 45 kilowatt generator instead. There's plenty of money in the project to facilitate that. We don't even actually have to ask FEMA for a budget amendment, but because the 45 kilowatt generator physically is a little bit bigger, the dimensions of the concrete pad that it will sit on will be like 2 feet, like larger, wider, longer. And for that reason, we have to ask FEMA for a scope change. And the commission was the sponsor for the FEMA funds, so that request would have to come from the commission. And that is it. No, we're not even asking for budgetary changes, just to increase the size of the pad to upgrade the generator to a 45 instead of a 25.
I'll say.
Yep, just a motion to approve the scope change.
I'll make a motion.
That motion's on the floor. Is there any further discussion or questions? Hearing none, all those in favor signify by saying aye.
Aye.
Aye. All those against, the motion does carry. And I'll sign this request now. Patty, if you want to. Do everything you need to do with this.
Have they started the pad already, or they're gonna have to add to it, or has the physical work began?
No,
Okay,
it
good.
has not. What they really wanted to do is go ahead and get the pads all set up and maybe like the transfer switches and that sort of thing. But the generators, the lead time on those is so long, they won't actually even be received until May.
Okay.
So the contractor has taken a little bit of a risk and gone ahead and ordered this 45 kilowatt generator with the understanding that FEMA has to approve this because they're going to be in very high demand,
Right.
and there's already such a long lead time. They were really nervous if they didn't, that, it would be forever, so it'd be really good to work with on it.
I know we had asked at one point in time, what PSDs do not have generators?
We probably have to do a survey.
Okay.
And some of them may have generators at specific locations, but maybe not all, or like
Like pump
Craigville
stations or something.
now has generators at all of their water booster stations, but I don't know what they have on the sewer side.
Okay.
But it'd be easy to run that down. Did we make it through the motion on the? Okay,
Yes.
All right. So moving on to Birch River PSD. Their project went to bid last Tuesday, I believe it was. The first budget in this packet is the post-bid project rate. And then behind that, you'll see the pre-bid project budget. There was one particular contractor who bid very, very competitively. The engineering firm has fully vetted their bid and they are in good order to award. But with that said, so if you'll look at construction item 1, third row down, the underrun, the project came in under budget, the amount of like $464,000. So with that much funding, the PSD may have the ability to extend the water service on out to Mill Creek to 12 additional customers, which was going to be like a whole completely separate phase. It's going to be somewhat of a challenge to get that approved. We have to get all of the environmental letters updated, and because of the funding we're working with, we'll have to do an income survey of those 12 additional residents. So they have to qualify by income, and we have to get all of the environmental clearances updated, And also, some permitting will have to be updated, but we are working as quickly as possible to try to make that happen. So it's a really exciting opportunity. Hopefully, all of the pieces will come together and they'll be able to serve 12 additional customers.
Is there a contingency plan in case the income qualifications aren't met? That this
If-
money can be used somewhere in that PSD?
No, there wouldn't be any opportunity to do it anywhere else, to be honest. And there's a 90-day bid hold, so all of this has to happen like 90 days from last Tuesday.
Gotcha.
Like, we're
Good
able.
problem to have, though.
We're able to maybe get these environmental clearances updated because it's like 7,200 more linear feet, you know, in the same general area.
Right.
It would be too far outside of the scope to try to do anything anywhere else.
So if we can use the funding, I mean, like somewhere, that we don't just lose it.
I don't know that we would have the opportunity,
Gotcha.
to be honest. But we're gonna try really hard, very hard.
Much appreciated.
So your income surveys and stuff like that, when will that be done?
We have the form prepared, plan to get it to the PSD today, and so they will have to work really quickly to get those knocked out. And then we also are working with Greg on that project. He's the legal counsel for the PSD. We'll have to see if there are any additional easements needed. Those will have to be, you know, taken care of. So it's a lot really quickly, but we're gonna try. In regard to the budget amendment, I'm just trying to be as prepared as possible. This budget amendment may not end up being submitted. Just wanted to go ahead and have it in place. Like I said, just trying to really be, you know, as thoughtful as possible moving forward. So essentially what we did with this budget amendment, this project is funded by the Community Development Block Grant Program and the Infrastructure Jobs and Development Council. And we just moved money back and forth between the two just for ease of facilitating the project once it is, you know, I mean, all the funds are available, but once it's, like the contracts are awarded and that sort of thing. So we increased the construction line item in CDBG and the permitting, and then we leveled that out by moving the accounting, remaining engineering, and legal fees into the infrastructure council funding. Our explanation was we just updated to reflect the post-bid budget, and our request is to prioritize the majority of remaining CDBG funds for construction, with remaining accounting, engineering, and legal costs to be moved to the IJDC portion of funding. It's just, it's really for our benefit at Region 4 to kind of swap some of the funds around, knowing who processes more quickly, whose procedures are followed more easily, that sort of thing.
Could I see that by chance?
Yes, absolutely. So the total
Thank you.
change to the budget is 0.
Right.
Yeah,
Just left-hand or right-hand?
yeah. And we expect, even if we are able to get these 12 additional customers, we'll probably still have a little bit of funding left. As I mentioned, I don't know that they will let us use that. They may want to just take that back right then. Maybe they'll let us hold on to it just as an extra contingency for the project. But if they do want to take that right back, then we would probably come back with another budget amendment. So that's why we're going to hold on to that, so we don't budget amend everyone to death, but we just wanted to be prepared.
Yes, please.
I'll make that motion.
Commissioner Chapman made the motion to approve the CDBG budget amendment, as explained by Ms. Lawson. All those in favor signify by saying aye.
Aye.
Aye. All those against, the motion does carry. There's that as well. Thank you.
That's all I have for it, unless you guys have any questions about Mill Creek or the generator project.
I believe so.
It was really exciting that the bids came in that low. And at first, everyone was kind of like, okay, did they miss something in their bid? But this particular contractor did a direct purchase on the generator that's gonna be on the Mill Creek booster station instead of using actually C2G, the contractor that's doing the generator project. And that saved them a ton of money. So,
Thank you very much.
absolutely.
We now have, at my request, a discussion on the Summersville Visitor Center. As we know, this plan has changed some. That real estate that was once available just, frankly, due to the sellers, is just apparently no longer available. The city has an opportunity to move elsewhere, of course, with the new state park. We had originally committed $800,000 of parts of our ARP and different funding like that. I think it was ARP on that. And that was specifically to purchase land. So that motion is null and void with the no longer need to purchase land. However, the city is requesting that the commission contribute towards the construction of the facility, but at a reduced rate, $300,000 less, requesting instead only $500,000 with no contingencies. And I will support that and would like to see if we could give the city some sort of response here this morning.
I make a motion that we reduce it to $500,000, but one contingency is one of us has a seat on the board.
I don't have a problem with that. That motion's on the floor. Is there any further discussion? That being said, all those in favor signify by saying aye.
Aye.
All those against the motion does carry. Short and sweet. Now we'll go straight to the Nicholas County Building Commission. We're grateful to have multiple members here this morning, and this is a discussion on real estate. Being the matters of real estate, purchasing or selling, I would like to request that the commission go into an executive session again with the members of the building commission, their staff, the commission, and our legal counsel remain in the room. The motion is on the floor. It is 10:03 a.m. Is there any further discussion? Hearing none, all those in favor signify by saying aye. Aye. All those against, the motion does carry. This is pursuant to West Virginia Code 6-9A-4. We do stand into executive session and ask everyone else to please leave the room. Okay, it is now 11 a.m. Do I hear a motion to exit executive session pursuant to West Virginia Code 6-9A-4? For the record, there were no decisions made during that executive session. We appreciate the time of the building commission here this morning. They have already exited the room, but again, no decisions were made by either entity. And do we have a motion?
Motion.
The motion's on the floor. Is there any further discussion? Hearing none, all those in favor signify by saying aye.
Aye.
All those against, the motion does carry. That being said, we have with us Ms. Alyssa Query, and this is, she is a representative of Compass Job Exploration. And this is regarding placing kids ages 14 and up into job experience opportunities. So if you don't mind to come up for the commission, the floor is yours.
Can we sit here?
Sure.
Okay. Okay, again, my name is Alyssa Query. I'm a state vendor through Division of Rehabilitation Services. What that is youth with disabilities. We do, which is not, I hate the word rehabilitation, but, so we do rehabilitation for vocational purposes. What we do is we work statewide. I reside in Nicholas County now. We work with a lot of other courthouses in the state. So what we're asking, if we work 14 and up, at the age of 16, they become eligible for work programs with us. Would we be able to set up work sites within the courthouse? They are supervised. If they are a youth with a severe disability, they're supervised the whole time. If they are not, they can work independently depending on their work history, things like that. We cover all wages, all comp, everything comes back on our company. You have nothing except providing them job duties, experience, things like that. Just to give them a little bit of work history, something to put on a resume. Again, I mean, there's nothing you guys will be responsible for. And it could be any task that whatever office would see fit that they could do successfully. Questions? That's like the brief side of it.
Does this parallel like something like Bright Horizons?
Actually, so Bright Horizons, So Bright Horizons is for like waiver clients. I'm not sure if you're familiar with waiver. So those are your more severe disabilities.
Right.
It's similar. Once they go into Bright Horizons, that's not considered integrated employment because they only employ youth with disabilities. Where we want to get them into an integrated setting, which is they can work essentially anywhere as long as they can perform the job duties.
Correct.
So,
So it's an individual assessment, and you match them up to their capabilities, and you find an employer that needs that skill or set. Okay.
yeah. But we're just having trouble finding places within the county that, one, want to work with our kids. And a lot of these kids are college bound or home for college. And we're just placing them in a summer employment for 480 hours. You know, trying to get them in places that they know they want to work so they can see some behind the scenes. But also, you know, let them build some of their skills that they just haven't had the opportunity to.
So like ADD, things like
Yeah,
that?
ADD, you know, and if they're supervised, I mean, it could be, we service all disabilities. So currently, for example, there's a young man we're serving and maybe he will be autistic. Those students will be supervised at that time. Any other questions?
Would the county be covered under your liability policy?
Yes. And we can provide, I think in some counties, they, you know, ask that we provide copies of everything, and we can do that. That's not an issue.
And the jobs you're looking at would be provided by the courthouse staff. You're not looking for a facilitator, in other words, another business comes in here and uses.
Right, we're
this.
we're looking like at here.
So we
at
have
the
to have an
courthouse.
internal liaison at the courthouse, somebody that they work directly with.
It could be anything, could be anything like other entities we have, like the animal shelter or the
Yeah,
park or
sure.
things like that.
Gotcha.
What do you need from us?
Just I was told I had to present to you guys to see if you guys approve for us to be here.
Have you worked with anybody inside the courthouse yet to identify a space or? any
We
sort of-
haven't, no,
Okay.
this was our
All
first
right.
step.
Just
Once,
key in the door.
yeah, like once we would do that, we would kind of assess, and we don't have anybody in mind right this second, but, I mean, we continually work with them all year round. So as students would come in, we would say, hey, you know, maybe they would be a fit, or, you know, something that, sometimes we need places that have multiple job settings versus like, I don't know, we work with the city a lot. That may just be like their street department.
Right.
Well, not everybody's a fit for that.
Right.
So, you know, we're just trying to add more to the book of what our students could benefit from here in the county.
And how many, what's your current caseload? How many people do you currently?
We service the whole state.
Well, I mean, like Nicholas County.
Okay.
Like how many people do you have enrolled in that program in Nicholas County? Or are there any yet?
Yeah, there are. We have about 30 services we offer. Total in the county, I'd say we're looking between 400 to 500.
I guess maybe, so the question I'm asking, how many people do you have enrolled in that program?
In
Students.
just the work programs?
Yes.
So there's multiple work, there's actually 5 different work programs. Currently enrolled in there, I would say you're looking at 80.
Okay.
Yeah.
And you said you're already with the city of Summersville?
I have a question. You mentioned 480 hours. Is that a month?
No, so what we do is we offer a 60-hour program, which would be like the initial, to see if, one, they could do the job duties. And then how much work is this student, like, are they a high school student? You know, are they home from college? Do they graduate looking for full-time employment? There's a lot of different factors that go into it. There's a 60-hour program, but it goes all the way up to 480. The 480 would be what I would like to think of as more like a summer internship, and we use those a lot of times for like our college students that are like home, wanting to try something more in their field, or to be honest, just looking for summer employment that they couldn't find that we would help them with placement.
So that's like 12 weeks full-time.
And then we, of course, pay whatever, you know, the job duties, whatever you guys pay, the position would help. That's what we pay,
Comparable wage or
yes, for that position.
My only reservation in the whole thing would be, you work with the departmental heads, you know, there's different departments inside you know, you don't walk in and say, county commission said we can do this.
No, yeah.
Right, it'd have to
Just
be
make-
by
make it
department,
very
I agree
clear
with that.
Yeah.
Yeah. And we could do that, as kids express interest, present to them. and
Yeah,
also,
too.
Their thoughts.
Same thing, or just give that approval.
Yeah, I'd make a motion with that by department approval, just so you know.
I'll make a motion that we enter into an agreement with them that they can enter in with each department head and what they do.
Any other discussion? Hearing none, all those in favor signify by saying aye.
Aye.
All those against, the motion does carry. So, thank you very much, and
Thank you.
what we'll do is just keep in contact with Patty, and she can help you with the different departments, and so on and so forth.
All righty, thank you.
Thank you.
And we can't hire this.
I'm Patty.
Okay, yeah, thank you.
Of course, we could, we might need
We have a
some.
few positions. We do have a few available positions.
We have my contact information.
Yeah. that's what it says.
Was it? No, I'm sorry. No, just again.
Right.
Yeah, here's my gavel. This is my Gary gavel. He actually bought this for me when he was
You
running.
should rack that thing a little harder, though.
Well, I usually forget it's even there. But
Taps.
anyways, it's ironic that the man that bought it is usually the one that I need to use it
The
on.
offender.
Rather this way or that way.
Right? Left hand's better.
Regardless, we have now with us Dr. Anita Stewart with the Nicholas County Health Department. We need to amend our agenda. It says Summersville Health Department. We are the Nicholas County Health Department. But regardless, we have with us this morning the doctor for a public health update. Tell him that.
I didn't hold for that one, anything, just looking at it.
Hi guys, so I'm Dr. Anita Stewart. I am the health officer at the Nicholas County Health Department and have been hired full-time to serve Nicholas County in all capacities for public health as what they like to call like the chief health strategist for our county. And so today I appreciate you having me here. I just wanted to come give some brief public health updates about the status of affairs here in Nicholas County. First on the agenda, we are currently doing a community health assessment, which helps us determine as a county what are the biggest needs in Nicholas County, what do the citizens think are the biggest public health concerns, and certainly areas that we need to work and put some energy towards just to make this place a safer, healthier place to live. So I'll leave you the QR codes for that partner survey, as well as I've sent those electronically to you already. So please do those and share those forward. The biggest thing right now on the horizons is we're coming into respiratory season. It's October. We know that we're already seeing increases. Kids are back to school. We always see a little bit of an upswing in respiratory viruses, but we are certainly seeing that this season with influenza A, COVID-19, and then we are starting to see a slight nudge of RSV. Those are our big three respiratory viruses that we know can be concerning and certainly in high-risk populations lead to a more severe illness and sometimes hospitalizations and beyond. So things to look for, we know that this affects, sometimes up to 10% of the population with influenza each season. So just making sure that we're doing our common sense things to help keep from passing that and sharing that to one another. This season will be no different. We do anticipate having a fairly significant respiratory season again, similar to last year. So we are encouraging folks to use all the prevention measures that they have to try to layer those on top of one another So washing your hands, staying home when you're sick, wiping surfaces, masking, covering coughs and sneezes, and then our best tool in our tool belt to prevent these infections certainly is vaccination. So we do have updated versions of the influenza vaccine, the COVID-19 vaccine, and this year we also have an RSV vaccine. So anyone over the age of 50 would be eligible for an RSV vaccine. And we also have for children, newborns through the age of a year, and then in high-risk infants up to 2 years are eligible for an RSV product. It's called a monoclonal antibody. It's a vaccine-like product to help prevent severe illness from RSV in kids and reduce hospitalizations by about 60%, which is great. So remember, it's really important to get those vaccinations. You can get them now. You can mix and match those products. You can get them all at the same time. Most of our local pharmacies and healthcare providers have them. We certainly have them at the Nicholas County Health Department, and encourage our community to keep themselves safe and to protect their friends, neighbors, and families from getting sick by doing these things. If you are feeling ill, it's really important that you are staying home, and that there are tests available to help diagnose those. There's over-the-counter rapid COVID tests, and then certainly most healthcare offices have the capacity to test on site as well. There are treatments available if you are test positive for any of those. We typically say, supportive care, taking care of yourself, getting plenty of rest, staying healthy, eating well, to kind of stay this off. But for the higher risk populations, we should be offering antiviral treatment for those, for flu and COVID, because that can certainly reduce the risk of hospitalization and death, so, which is a very important marker. The only other thing for October, remember it's Breast Cancer Awareness Month, so making sure that you're up to date on your breast cancer screenings, and again, always important to stay healthy and active all the way through the year, especially if you're getting ready to do big hunting trips or hunting season, making sure that you're kind of building up to that mountain climb ahead of time. All right, that's really all I have from a public health lens. Any questions?
I have a question. Of course, can you get the flu shot, the RSV, and the COVID-19 all at the same time?
Absolutely, yes. You can mix and match, and you can get them all at the same time. Right. Oh, and those are all covered by insurance as well. If you have health insurance, if you're uninsured, we have those products available at the health department.
Now, when you say things are available, where all those, so somebody can just drop in and say, hey, I need this. You can accommodate that, or is there an appointment got to be made, things like that?
So we are currently doing outreach clinics across the county. So it is important if you're coming to the health department to call ahead, because we do have limited staff and our nurses are out giving those vaccinations at any given time. But call ahead. We do our best to accommodate on a daily basis those vaccinations.
You're getting that today.
I was being there for the public.
Yeah, and if you are a business or an organization that wants to schedule an event, or a church, or another community-based organization, we're happy to facilitate that on site at those locations.
So is there the ability to partner up with the schools, and if it exists, I don't know if already. So as a parent, I know that every year my kids are going to come home with some snotty boogies and that gastrointestinal virus that passes through the schools and this and that. So I know that during COVID there was a huge push for hand sanitizer and things like that. I'd actually just messaged my son, I don't know if he'll message me during lunch or not, to determine if they still have those in the school. And I know some of the medical facilities, they have a spray that they can just walk down the hall with and spray. Would there be the opportunity to do something like that during flu season and provide that direction assistance or that technical expertise to spray the hallways once a week or something during the peak seasons?
I can't speak directly for the Board of Education, but certainly the health department will be willing to partner to talk about infection prevention strategies that would make the most sense for those facilities. And certainly if we're looking at an increase in cases, which we are still following caseloads of all respiratory viruses, not just COVID.
Right.
We've moved into this like a respiratory pathogen type approach. We would we would be doing those things already. But I'm with you, I think it's important that we're thinking about that in a preventative
Right.
fashion and being proactive so we don't end up in that position.
I mean, I'd like, my wish list would be that there would be a partnership, because you guys would be the subject matter expert in the application process and what product to use. And maybe even provide that just, for 1 month or something like that during the school period.
Yeah.
To spray once a week.
Yeah, I think that's something we can do. We have a great relationship with the Board of Education and have a strong liaison with their school nursing.
Because we've actually, I've seen the parent volunteers go in on like Fridays and wipe everything down, at the end of the week. That way, because it just starts running rampant through the schools once it gets started. And then, you bring it home, it hits the adults, and it just starts expanding out from there. Especially with a lot of the grand families and that stuff that we have in the area. Your
And-
parents raising kids.
Well, there was a lot of stuff bought through the coding stuff, the machinery that could be reused, and now it's just on the shelf.
Right.
Yeah, I think that what we can be charged to do will be to kind of take stock of what is available in the community. This is my first season here as a full-time health officer, and certainly getting my bearings with what's already available in this community. And then once we have that, certainly being able to share resources with different groups, I think makes a lot of sense here. Because our whole goal is to keep everyone safe and healthy. And so everyone, in this community understands that vision and wants to see that.
And I would hope that, if there are resources stockpiled, you're hitting shelf life expirations and things like that, that we use them and, maybe try to replenish them versus let them sit there and hoard and let things expire.
Exactly. Another strong partner here is OEMS. I know that Mr. McGinnis has been a really strong partner already, and they were a very integral piece during that piece of it, like making sure that who needed what personal protective equipment and hand sanitizer and all these things, and certainly can work together to make sure those things are covered.
And speaking of, we're very happy to have you as the county health officer, and with the boards we set on the things you do fabulous for this county. We're glad to have you.
Thank you. I'm glad to be here. I live here, and my children are here, and my family, so I think thrilled to be in this role.
And are you able to release like a brief summation of some of the highly infectious viruses, STDs, and things like that that are present in the county?
Do you want me to speak to that now?
Yes,
Yeah.
just a summation.
Yeah,
A
so.
lot of people watch this, so good way to get information.
Yeah, I think that's really important. I think that the more transparency and awareness there is about what's happening in our community, the safer that we can become, and the more proactive we can all be to protect our health and to protect our loved ones. And so we are seeing increases in sexually transmitted infections in Nicholas County as well as with surrounding counties. So some examples of that, the biggest one is syphilis, which we haven't seen for decades. And in West Virginia and across the country, we saw an increase starting in 2018, and certainly Nicholas County is not immune to that. And in the last 2 years, we've seen about a 200% increase in syphilis cases in Nicholas County. And so ensuring that, if you are having symptoms consistent with that, so a rash or not feeling well.
A general rash, is that literally, is that what's going to
Yeah,
start? Okay.
yeah, a general rash. Certainly to have that on a differential, healthcare providers here have been educated, they know that this is happening, it's higher on their radar, and then certainly making sure that if it certainly is syphilis, that we get the appropriate treatment in a timely fashion so we can we can treat it and cure it, and then stop the spread of that. We know
Particular
that
age range with that?
it's 18 to 40 is our highest, is about our range. We're seeing it in persons that are unstably housed. We're seeing it with high-risk sexual behavior and associated with IV drug use. So certainly any other high-risk behaviors, just making sure that we can put strategies in so one can reduce harm. So always using barrier protection during sexual encounters, and then making sure that if you are having symptoms, that you get evaluated and know that there is treatment for that. The other thing that we know goes with syphilis is HIV and hepatitis. So certainly are seeing some things here that are concerning and are working with partners across the county. Newver Health, Camden Family Health, Summersville Regional Medical Center, Seneca have all been really strong partners in making sure that we are testing and treating appropriately. We can cure hepatitis C now with medications. And then certainly we can treat HIV to where it's undetectable, which means it's not transmissible. So,
And there are some long-term major implications with syphilis, right?
absolutely, yeah. You can have neurologic complications, psychiatric complications related to that.
Prolong it only increases the activity or the chances of that happening.
Exactly, and it increases your risk of spreading it to
Right.
someone else.
And are contraceptives still provided in the school or by the health department?
So we
Like the
currently do
barrier?
not have a family planning program for like oral contraceptives. For barrier methods to prevent sexually transmitted infections, we absolutely have condoms,
Right.
male and female at the health department. Our school-based health centers are, care is provided by New River Health Association. I'll have to double check with them to see what they're able to provide there. But certainly think it's important that those are available to all age groups.
Maybe even in an anonymous setting where
And
you're
it
not
is
filling
absolutely-
paperwork out or,
It is absolutely anonymous at the Nicholas County Department,
Gotcha.
and encouraged for people to have to stay safe.
Yes.
Any
Yep.
other questions?
Now, do you get data information like each doctor's office, clinic, things like that for your data, or is this just data that you've collected?
Some items are mandatorily reported, right?
Yeah, so
Like
there's a
HIV
reportable
case or-
disease rule,
yes.
and those are reported by the state code, and depending on the type of disease would be reported to different entities. So like HIV, for instance, is reported directly to the state. Now, we do work with our state partners to help identify patients and find patients a lot of times, because we are, the local experts in our community. And like I said, there are other reportable diseases that come directly to us that we manage. And then the data that we pull is, I can pull from a database that I try to run. But honestly, I get a lot of like what I call like syndromic surveillance. So knowing like what's coming in, what are you seeing in your offices, what's coming through the ED, what's happening, just from relationships with partners. And so I appreciate, we're blessed here to have really strong healthcare partners that are willing to share that information and that are calling and saying, hey, I'm seeing this is strange, I've seen a
Right.
trend. And so having those strong relationships helps to kind of stave off anything early, just to prevent spread and prevent clusters and outbreaks.
John, you have any?
Sounds good.
No, we're good. We talk on a weekly basis, so
He's a great partner.
we're good.
I didn't know you were behind.
That's nothing.
I thought that's why you were talking nice about him.
I did have one last thing that you spoke about, COVID test kits
Yes.
and COVID vaccinations. So COVID vaccinations are covered under your health insurance if you have it. If not, you guys are able to take care of that as well.
Yes.
And how does the testing go?
So COVID test kits, they did open the availability for each family to be able to order through United States Postal Service, like 4 more free test kits. So that is available. Coverage for test kits depends on insurance,
Gotcha.
as far as that goes. We will have some free test kits at the health department. We are trying to give some of those out at events, because it is important. If you're symptomatic and can test and know you have COVID and then can isolate and not spread it to anyone, that's really important for disease containment. So we encourage people to keep doing that. Remember, if you do test positive, it's 5 days from symptom onset, and then masking for days 6 through 10 to prevent spread to others, because we know you can shed up to 10 days after that initial symptoms. And certainly we can see that even longer in a person that might have an immunocompromise, like from cancer or chronic disease, diabetes or something. We are working actively to try to acquire more test kits to be able to give out, because we do know that it is a financial burden, and if we want people to test, I think it's important that we have those resources available.
And you do have Narcan and have that.
Yes.
Yeah, so we are working actively to try to reduce the amount of overdoses that we're having in our community, and certainly we want to reduce the amount of overdose deaths that we're having, which is happening here. And so we do have naloxone available at the health department. It's free. Naloxone is over the counter now, and certainly you can walk into a pharmacy and get that. We do know that sometimes that can be cost prohibitive. So if that's an issue, please, come to the health department. Seneca Health Systems also has naloxone. We also partner with like SOZOs and the Nicholas Intervention Coalition to distribute naloxone. So please, if that's something you're interested in, let us know. We're also working with our local healthcare partners, Camden Family Health, WVU Somersville, and Braxton are also going to try to start a distribution program. I think they've started in Camden, but we're actively working on things with the WVU Health Systems here. So that would be available from the emergency departments. That's our goal.
One last thing, I know we had talked about we need to start seeding the information so the understanding and the educational aspect is slowly seeded in the community is harm reduction.
Yeah, so harm reduction is sometimes a misunderstood
Right.
concept.
I've learned a lot.
And so, it's no different than me asking you to wear your seatbelt in the car. That is a harm reduction strategy that we know can reduce your risk of death and debility if you were in a car accident. So from a healthcare standpoint, we talk about harm reduction every time you go to the doctor. So like trying to smoke less if you're a tobacco user.
Wash
or
your hands.
washing your hands,
Correct.
exercising, all these things to try to make yourself healthier. Where things get a little bit misunderstood is in regards to drug use. And so I'm assuming that's what
Yes,
you're
ma'am.
asking about here.
Yes, ma'am.
And so I've given you lots of reasons already in this public health update of why harm reduction would be an important topic that we discuss here in Nicholas County. So we are seeing overdoses increase here related to drug use, and we're also seeing sexually transmitted infections and infections related to IV drug use increase here. So by being able to allow for a safe space and a safe way to reduce harm, and offering things to help reduce the spread of infection and to reduce overdose, we in turn will save lives. We know that it reduces the risk of infection and acquiring those diseases. And as like a secondary effect, we know that we see a lot of people that get supportive services as well as seek treatment and recovery opportunity by having that relationship in a harm reduction setting. So it is something that we're looking at from a public health lens and certainly looking very critically at with the Nicholas County Health Department and working with partners on how would we support that in this community. And so we did participate in Save a Life Day. There's certainly a very dramatic need in this community for harm reduction services here. And I do think that it would make sense to reduce those public health concerns. And
Is it fair to say that there is a pool of state or federal dollars, I'm assuming federal, and you pull from those, you reduce the impact in your area, and you're actually saving yourself money by is that a fair financial layman's
yeah, so
approach?
if people are dead, they can't contribute to your economy.
Or
right?
the cost of like hospitalization
Yeah,
and things like
absolutely,
that,
yeah.
or things spreading,
Yeah,
right?
so-
Yeah, and you
so-
can't pay taxes if you're not allowed.
Yeah, I think that it's important to think about the cost related to treating the infectious diseases. If somebody gets hepatitis or somebody gets HIV, it's $500,000.
Right.
I mean, so from a healthcare cost containment standpoint, it's really important that we don't get HIV.
I guess there's a pool of money that's already set aside
Yeah,
for
so
that.
there-
Why would we not engage in that?
Right, so there are federal dollars available, there's actually state funding. We are exploring options and working with our state partners to look at, they're really encouraging harm reduction programming. And there are funding opportunities for startup programs that we hope to apply for. just to explore some of these things, to talk more about harm reduction, and to go through all the steps necessary to maintain a licensure. You have to have a licensure in West Virginia to do harm reduction services.
So that would be an independent organization, or that would be like the
That
health
would be
department or
with the health
something?
department and partners.
Okay.
Yeah. And it could be any of those things,
Right.
though. Traditionally in West Virginia, it has been health departments. There are some community-based organizations like Mount Pushkar and Morgantown. But here locally, I think that would be a role and duty of the health department. But again, there are funding opportunities available, and then there's also funding, because we know that this is such an important strategy. It was just released by SAMHSA, as an important strategy for recovery, but also for agencies that are working to prevent HIV. So ending the HIV epidemic, it's a huge push as one of the four pillars. It's in our state HIV elimination plan as one of the key strategies that we need to be implementing. And so I think that to really be practicing as evidence-based and best care, that would be important for us to be implementing here.
The thing I like to harp on, we do have HIV in Nicholas County.
We have HIV in Nicholas County.
Yes.
Absolutely.
And one case can become 2 to 3, and
Yeah.
they just go exponentially from
Yeah.
there.
Yeah, and I wish I would have brought, there's this beautiful diagram that shows it's this like exponential spread,
Right.
and I can share that with you guys, but it's basically, it's the visual of like how one case becomes, a whole cluster. And so certainly I think it's important that, this is about taking care of one another and loving one another and doing the best to, again, to have a healthy and safe community. And there's lots of different strategies that we need to implement to do that.
Thank you.
Thank you very much.
Yeah, appreciate you guys.
Appreciate you.
We're having one of those meetings.
Yeah.
That's right. That's right. Towards the end, do you still need to talk with us, or did we figure that out?
No, this is simple.
Okay.
Yep.
Let's move forward then to commissioners' comments. I have 2. I have been requested by the city to announce, and Patty, if you could please make a memo to be dispersed, that effective October 9th, next Monday, that the city will begin writing tickets at meters, all meters. And this is due to a number of downtown business owner requests. And so, we need to make sure all county employees understand that we need to make use of county property, or I guess pay the meter. I'm not in that part of it, but anyway, that is what I was requested of. And also, Halloween this year, both cities and the county are asking their citizens to observe it on October 31st, and that was 6 to 8 p.m.
5 to 7 or 6 to 8, depending on which one you read.
Let's just say 5 to 8, and everybody have a
There you
good
go.
time,
There you
because
go.
I do not recall
Get
right
lots of
now.
candy.
But that's all that I have at this time.
Good. So just a couple things real quick. Harm reduction that we just spoke of. I think, the more that you educate yourself, and the more I've educated myself, the more sense it makes, especially when you break it down where the funding comes from. People are always like, my dollars, my dollars, my dollars. That's a pool of money that's set aside. Why we would be a fool not to actually go out and try to pull that down and utilize it in our county to better ourselves in health aspects. And the visitor center, I want to touch back on that real quick, just in case folks are going to ask. We had a $300,000 cost savings by partnering up with the state. So that's going to be a multi-partnership with the state, the city of Summersville, and the county of Nicholas County, I should say. And we were able to recoup $300,000 because part of the original bid is if that property wasn't acquired, the money come back. So we're still going to work on that partnership to drive business into our county. And I think it's going to be a really wise and a really good investment. Actually, a lot even more bang for our buck than we initially thought. So that's all I got.
And we're working with Dr. Stewart, where I have been on a vape ordinance that we'll be working on that coming up hear about that very soon.
Yeah.
Motion to adjourn. Oh, wait, we've got to do something.
Just this letter from the state, it's just an invoice. All it needs is your signature. We will copy scan this with our county letterhead on it.
Yeah.
Send it back to the state. Then the guidelines for the budget approval, which we were awarded, will be sent to the county commission along with the disbursement guidelines.
Now, so that's gonna be dispersed to the ambulance providers?
And fire departments
And fire
will provide, yeah.
Or does that include both ambulance providers in the county?
Yes,
Okay, great.
yes.
So more will come with that next meeting once we figure out there when we actually disperse. Okay. Okay, anything else? That being said, Commissioner Chapman has on the floor a motion to adjourn this regularly scheduled meeting, October 4th, 2023 of the Nicholas County Commission. All those in favor signify by saying aye.
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 All those against, the motion does carry.